I always try to take a deep breath. There is a reality here, certainly a public perception reality. The President of the United States smoked pot when he was in high school and college. He turned out okay. And what we're talking about in Ohio is medical marijuana. If a 77-year-old woman is dying of stomach cancer, as an example, I think a lot of people would say, why is the government involved in preventing her if she feels this gives her relief from stepping in and preventing that? Why should the government be involved in that?
It's not just about her. It's really about our young people. It's about the environment that grows up around that. And my 77-year-old patients with stomach cancer would get medicine from me and not a recommendation to use marijuana. In fact, in the old and infirm, you are more likely to have a paranoid reaction or a negative affect in using marijuana. And if you talk to people as they age, they don't want to use marijuana. This is not about your 76-year-old grandmother, gripping at a marijuana joint on her deathbed. It is not about her. It's about a 30-year-old who's living in his mother's basement who still wants to smoke marijuana. He's got a shoebox top under his bed where he separates his weed from the seed. It's not about your 76-year-old grandmother who could have better care and who actually would be adversely affected by having access to something with pesticides and contaminants and the psychotic episodes that develop in response to it, and something that is completely unregulated, not characterized from a scientific perspective. It can't be delivered in a reproducible way to her.
But the 30-year-old would still have that pot in the basement anyway, right? I mean, medical marijuana changes the dynamics so that it becomes available for those that are sick.
We don't have medical Marlboros, and we don't have medical Scotch. Why is it that we don't have them? There are people who...
But alcohol is legal.
There are people who use a little alcohol for some sedation and for pain control. Yeah, and they do that before they advance themselves to seeing a doctor and getting more extensive care for whatever ails them. But the people who are using a nip of Scotch, they're not treating a stomach cancer pain. They're treating, a thumb that they hit with a hammer when they were on the roof that afternoon. So there is this misperception that this is something that the sick and dying really need in order to ease their suffering. That 76-year-old woman, my 85-year-old mother-in-law who died of brain cancer last year, got medicine for that. She didn't get marijuana. We didn't offer her that. And she died without pain. If we'd given her marijuana, she would have died in a stupor, unable to communicate with us, but in pain. There's no real clear and compelling evidence that marijuana works with the pain receptors in the way that the opioids do. And I know you've heard it. People have said, I don't want to use opioids because it's trading one disability for another. I suggest to you that it's probably because it's not used in a deft way, in the hands of a skilled physician. And perhaps what happened was those doses were pushed by somebody that may have developed a dependence on the opioid. But, I didn't want my 85-year-old mother-in-law to get marijuana when she was dying with a brain tumor. I want her to get real medicine, something that we knew what she was getting.